Can a diabetic eat mangoes? So this is the common confusion the patients will be having, especially the diabetic patients will be having. So because the mango is the most sweetest fruit, it's also called as the king of fruits. So it is sweeter. So that's why the diabetic, especially the diabetic patients, try to avoid this fruit. So along with this, so most of the doctors as well as the so-called dietitians keep telling that avoid using sweet fruits. So not only that, so many videos in social media keep telling that to avoid almost all the sweet fruits, especially the mango. Let us see how far this is true. So generally, whatever we eat, the food what we eat, the common food that is either rice, roti, ragi or chapati will be having what is the composition, what is the content of that food? It will be having 70 to 75% of carbohydrate. That carbohydrate is in the form of a starch. Starch is nothing but a complex glucose. So even though 70 to 75% carbohydrate, that is the glucose is there, it doesn't taste sweet because it's a complex glucose. Starch is nothing but a complex glucose and our taste buds are not being activated by this complex glucose. That's why the rice, roti will not taste sweeter even though it has maximum, that is the 75% of glucose. So along with this carbohydrate, the food will be having around 6 to 8% or even up to 10% of proteins, then fibers, certain amount of vitamins as well as minerals will be there in our regular normal food. So next, along with this rice, roti, what we eat is high protein, what we call as high protein diet, that is the grams. Second, this grams, what these grams will have? So grams will be having around 65% of carbohydrate. See, we call this as a high protein diet. Still, it will be having 65% of carbohydrate. So along with the carbohydrate, it will be having little more protein. Then along with that, fiber, vitamins as well as minerals will be there. Third thing is the most healthy food, especially healthy for the diabetic, so-called millets. So what these millets will be having? So again, this millets will be having around 65% of carbohydrates. Even though it is being recommended for the diabetics, so this millets will be having 65% of carbohydrates. So along with this carbohydrate, little bit of fiber, little bit of proteins, vitamins as well as minerals will be there. So the regular food, that is the grains as well as the millets and the grams, almost all the three of them will be having the carbohydrates ranging from 65 to 75%. Next, coming to the mango, so the mango will be having 85% water. Main component of this mango is 85% water. Then carbohydrate, how much carbohydrate has got? It is a 12 to 14%, only 12 to 14% carbohydrate in the form of glucose and fructose. So along with that, it will be having the vitamins, minerals, fiber, 1% of fat, everything that our body needs will be there. So comparison wise, the grains, millets as well as the grams, which is our main food, will be having the carbohydrate of 65 to 75%, whereas the most sweet fruit, that is the mango, will be having a carbohydrate of 12 to 14%. Second, in that 12 to 14% of a carbohydrate that is there in the mango, it's a non-starchy carbohydrate. It's a non-sticky, it's a non-starchy carbohydrate, which is the healthiest, most healthiest form of food. So along with that, the fiber, the fat, 1% fat, 1% protein, vitamins, and it has got so many minerals, many vitamins and minerals in it. That is the fruit, especially the mango fruit will be having the vitamins and the minerals which are most healthy, which are most essential to us. So diabetic patients can definitely eat a mango because it's the most healthiest of fruit, healthiest food compared to your regular food. But your regular food will be having the carbohydrate which is a starchy carbohydrate. Starchy carbohydrate is unhealthy. But what we do, we eat regularly, we eat these grains which contains the starchy food, which is again which is unhealthy for our diet, especially for the diabetic patients. The problem lies in this. Generally, how we eat our so-called regular food or so-called normal food, having either the millets, grams, as well as the grains. Then after that, added to that, we eat the fruits. So the health issues there, a rise in your glucose level is not because of the fruit what we eat, but it is because of the grains that we eat. But still, the fruit is being blamed. Then how to eat fruits? Generally, how to eat fruits, especially if you are a diabetic, then how to eat mango? So mango will have all the nutrients that we need, even better nutrients than any of these grains. So we are supposed to eat only mango. So along with the mango, you can add some other fruits, but don't eat fruits, especially the mango, along with this so-called regular food, that is the grains. So the fruit, that is the mango, should be your meal. It should not be a part of your meal. Mango should be your meal. Then your sugar level will not increase. My advice is, don't get misguided by the so-called dietitians, some of the doctors, as well as the Facebook videos. Think scientifically. So whatever the explanation so far I gave, they are scientifically proven. If you need scientific and precise information about health, then only subscribe to our channel. Namaste.